Well, we're going to return now to the end of our conversation with the former health insurance spokesperson, Wendell Potter. Yes, he's formerly head of corporate communications at the insurance giant CIGNA, now fellow at the Center for Media and Democracy. Can you talk about the way the Senate now is dealing with health care and Congress overall, and the power that the health insurance industry has over these politicians? I mean, you have people like Senator Max Baucus, who gets more money perhaps than anyone in the Senate from the health insurance, hospital, the health care industry, and he's head of the Senate Finance Committee.
That's right.
Talk about that strategy the insurance industry has in dealing with politicians and your thoughts on this.
Well, one thing to remember is that the health insurance industry has been anticipating this debate on health care reform for many years. They knew it was inevitable that it would come back, and they knew that if a Democrat were elected president, undoubtedly it would be on the top of the political agenda. So they've been positioning themselves to get very close to influential members of Congress in both parties, and Max Baucus is certainly someone they knew a long time ago was going to be critical for their interests. So yes, the insurance industry, the pharmaceutical industry, and others in healthcare have donated lots and lots, millions of dollars to his campaigns over the past few years. But aside from money, it's relationships that count, and that's why the insurance industry has hired scores and scores of lobbyists, many of whom have worked for members of Congress, and some who are former members of Congress, to lobby on their behalf. Some of Max Baucus's former staff members work for in the health insurance industry as lobbyists these days. That is very important. It helps to open the door, and it enables people who are aligned with the industry, who have good associations or close associations with members of Congress, to pass along the talking points or to express the industry's points of view. Yeah, for example, one of the companies hired a very influential lobbyist who has connections on the Democratic side. And one of the things that the industry has been doing is engaging in what's referred to as grass tops lobbying. And that means the top executives go to Washington and meet with members of Congress and try to persuade them, or at least make them see that they don't have two heads and that they're reasonable people and you should listen to us. One of the companies that I used to work for was able to get my former CEO in an audience with Hillary Clinton. And Hillary Clinton certainly, this was when she was still senator and was running for president, and her platform was very similar to Barack Obama's platform on health care reform. And she undoubtedly, more than almost anybody else in the Senate, knew the power and influence of the insurance industry. But she was willing to meet with the executives. So that just gives you an example of how doors can be opened for some of the most influential people on Capitol Hill. And most people can't imagine having that kind of access or that kind of entree to the power and leadership on Capitol Hill.
Was that when you were working for CIGNA?
It was. And one of the industry's lobbyists is Heather Podesta. Heather has her own company now. She used to be with another big firm called Blank Rome, which also is doing a significant amount of lobbying. But her husband is Tony Podesta. They are a power couple in Washington, if there ever was one. Tony is John Podesta's brother. And they themselves have contributed thousands and thousands of dollars to candidates over the past several years. So having someone like that on your team makes a huge difference in being able to get the foot in the door and to present your points of view.
Well, what about that? Tony's brother being John Podesta, who is seminal for the shaping of Obama policy, and the people who are, most significantly, the people who are put into the Obama administration. What is your understanding of how much influence he has on his brother?
You know, I don't know, and I think that would be something that would be very interesting for some reporters to ask, to call up both Podestas and just explore that and find out if they have conversations. And I don't know. I would be speculating, and I haven't been a part of any conversations that would suggest that there is anything untoward there, but I think it would be it's something that I think would be appropriate for the media to take a look at and just to do stories about the connections in Washington and how the insurance industry and others who have gained so much power and influence shape legislation, as it very likely will be shaping healthcare reform legislation this time.
The Washington Post recently had a piece about the nation's healthcare industry, hiring more than 350 former government officials and members of Congress to sway healthcare reform on Capitol Hill. According to lobbying records, 3 out of every 4 major healthcare companies have at least one former government insider on the payroll. Nearly half held positions under key committees and lawmakers, including Senators Max Baucus, as you mentioned, and Charles Grassley. Baucus, chair of the Senate Finance Committee, of course, which is largely steering health care reform. Baucus's aides, as you mentioned, recently held a meeting with a group of lobbyists that included 2 of his former chiefs of staff. The Washington Post says the healthcare industry is now spending $1.4 million a day on lobbying, totaling $126 million in the first fiscal quarter. I guess spending the money of the premiums of people. Perhaps a number have been denied, Wendell.
Well, there's no doubt that the money that insurance companies have to do their lobbying comes from premium income. One thing that people, I think, need to understand that I've been talking about, and was part of my testimony, was how less and less of a person's premium dollar is being spent actually to cover claims these days. Back when Bill Clinton was president and he and Hillary Clinton were trying to reform the healthcare system, back in 1993, on the average, 95 cents of every premium dollar was being spent to pay claims. Last year, it was down to just around 80 cents. So we've seen that much of a change in 15 years. And that coincides with the consolidation in the insurance industry and the industry becoming much more dominated by for-profit insurance companies.